DiGeorge syndrome. DiGeorge syndrome is a genetic disorder resulting from a chromosome 22 missing fragment. It is present from birth, and blood tests are frequently used to identify it shortly after birth in order to look for the abnormality in the gene. Some children may go through childhood without knowing they have it, but others may get severely sick or even die very infrequently.
So, what is the chances of passing DiGeorge syndrome to your child? The chances that a child may have this disorder increase if one or both parents have it or are carriers of the defective chromosome. With each pregnancy, a parent with this syndrome has a 50% risk of passing the deletion on to their child. However, since the deletion occurs randomly, there is no guarantee that the following child will have this syndrome or even be at high risk if the first child was born with it. Also, the likelihood of conceiving another child with this syndrome in a family where neither parent has it is very, very low, which is 1 in 100.
Patients with DiGeorge syndrome have a roughly threefold higher risk of developing psychological problems. A higher risk of some behavioral problems such as ADHD and autism, which have developmental trajectories that peak in childhood and early adolescence. These children may be abnormally active, hyperactive, and impulsive. Other symptoms may include birth anomalies such as congenital heart disease, which typically link with the neuromuscular system, such as delays in development and learning. Children will show delay in achieving early developmental milestones. At 6 months of age, children still cannot keep their head steady or reach out with their hands to grab objects. The children cannot walk alone at the age of 1.5. At the age of 2, they cannot speak in single words. They cannot scribble with a pen on paper, and they also cannot match basic colors or shapes. They also have problems to learn, think, and solve problems, and also have problems with their language abilities such as giving expression and speech. They also have problems with their gross motor ability, for instance, sitting, crawling, walking, running, and jumping, and their body strength, balance, limb coordination much later than developmentally appropriate. Patients with DiGeorge syndrome also have hearing and vision problems, and they are mainly associated with palate abnormalities. Moreover, they will have a higher risk of some psychiatric disorders such as schizophrenia, which may cause delusions, hallucinations, and lack of motivation.
So, what are the causes of DiGeorge syndrome? It is caused by a microdeletion on the chromosome 22, mainly the 22.q.11.2 region. So, it is a deletion where a microdeletion occurred at this particular region. Due to that event, a loss of TBX1 gene is also occurred at the Q arm of chromosome 22. The function of TBX1 gene is to encode transcription factors involved in the regulation of developmental processes. Common congenital disorder characterized by neural crash-related developmental defects has been associated with the deletion of the particular gene.
The type of treatments that are available is surgery, medication, and occupational therapy. Surgery is required for hard defects and cleft palate to repair them. Medication such as antibiotic is needed to treat infections. Calcium supplements are needed to raise low calcium levels. Occupational therapy such as speech therapy, physiotherapy, and special education is required for development.